Hello, everyone. Welcome to the second episode of Med Speaks. Today, we're joined with a very special guest.
Hi, my name is Neil. I'm a medical resident at UCLA Internal Medicine in Los Angeles, California. Thanks for having me on Med Speaks, Kabir.
No worries, no worries. So, today's episode is more specific and more geared towards studying medicine in the US. So, for anyone like me who wants to study medicine in the US after their 12th standard, well, this is the video for you guys. In the previous video, we had Dr. Archit, who showed us the path to becoming a doctor in India specifically. Well, I guess without any further ado, let's get into it.
Let's do it.
So, the first question, as always, is kind of some background or general information on you. So, what's some background information about you?
So I've lived in the United States pretty much all my life. I did my high school in Jackson, Mississippi, which is in the southern United States. And then I did undergraduate and med school at Tulane University, which is in New Orleans, Louisiana. And then after medical school, I matched for internal medicine at UCLA, which is University of California, Los Angeles, in Los Angeles, California. And I'm in my final year of residency, my third year residency, and I plan to do cardiology fellowship next year. And that's a 3-year fellowship. And then, after that, I'll be a full-blown cardiologist.
Perfect. That sounds really interesting. And you spoke about matching, and that's something we will come to very soon. So if you didn't understand that, don't worry, we are coming to that. So the next question is, well, you kind of answered it, is where you did your schooling career, which you said in Jackson, Mississippi, right? So the next question is, what made you want to study medicine? Why medicine?
Yeah, that's a great question for everyone to ask themselves if they're planning on pursuing a career in medicine. I think for me, I've always been fascinated by solving some of the big problems in the world, and there's no bigger problem than the health of every person. So for me, I think it's fascinating to really understand what causes people to become sick, and it's amazing to help somebody that is sick and get them better. And not only that, it's amazing to prevent someone from getting sick in the first place. And I think the great part of being a doctor is that you can do both of those things and help people live the lives that they want to live without suffering from sickness. And I think that's what I find the most enjoyment out of and very passionate about.
I think that's a perfect answer for this actually, because and at the end of the day, that's what all doctors are doing, and that's what all future doctors are aspiring to do. And it's great that you people like you and people like aspiring doctors are always out there to help people, and that's their whole sole purpose.
Exactly.
So the next question we have is kind of now getting into the process of becoming a doctor. But before we get into that, there's a small question I had for you about AP courses and IB courses. So for any new listeners who don't know what they are, AP courses are basically a class in India you can take outside of school. In the US, it's offered in the school. But since I'm Indian, I can speak for my own kind of perspective, which is like it's offered outside school, and it's college level classes that give you those college credits once you complete it. It's the test is out of 5, and there are many AP subjects to take. Personally, right now I've taken AP psychology, and I mean I'm only in the 9th grade, so I have a couple years to decide the other AP courses I want to take. But AP and IB courses give you around the same like college credits. I think IBHL level courses give you more, but of course that's for all my IB students. They will know what I'm talking about. So I wanted to ask you, AP courses, in when you're studying your 4 years in pre-med, do they help, or are they you don't really need them?
Yeah, so there's a couple advantages to having done AP courses during your high school. As you said, in the U.S., you can take them during your high school within the school. So I probably did about 5 or 6 AP courses, and they have 2 major advantages. One they're much harder than your regular standard course. So you take AP biology, it's going to be a much more difficult college level course than your regular biology. So that will just, make you more knowledgeable, smarter, better prepared for taking advanced classes during college. There's a test at the end of the year to see how much you learned during that course. And if you get, I think usually a 4 or 5 out of 5, then most colleges will allow you to allow you to have that as a AP credit or a college credit.
Yeah, I definitely think it's something a lot of international students really neglect or don't really know about. Whereas if international students do take them, it really helps your college application in a lot of cases. So now that we have that out of the way, if we didn't really delve into the deep depth of AP courses because that's not what we're here to talk about, I will leave a link down below to collegeboard.org, and they speak about AP courses and everything else. So you can check that in the description. But other than that, we're gonna come now into the meat of today's episode. So what is the process of becoming a doctor in the US from the end of high school to the operation theater?
Yeah, that's a great question. It's a bit different than the Indian system, and the process is there's similarities and differences. So I put together kind of a graphic that better illustrates that. If I could just share it with you, so I'll do that right now.
Definitely, definitely. I definitely think having a visual way of learning definitely helps.
So so you can see here, this is the process of becoming a doctor on the top, it's India, and then on the bottom, it's the United States. So over on the left side is when you finish high school. In India, you'll start your MBBS, and then in the United States, we don't necessarily go straight into med school. Most people will go and do a 4-year undergraduate degree, the college first. So once you finish your college, then you start your med school. So you're at the end of college, you're applying to many med schools, trying to get into the best med school you can. And after med school, which is 4 years, then you'll start residency. So you can see in India, it's a little bit quicker to get to the point where you start your residency. It's only 6 years. Whereas in the United States, you have to do the 4 years of college and then the 4 years of med school, and then you can start your residency. Generally, they're about the same length in India and the US. So at the point you start your residency, it's basically the same process until you are finished with your training. And in India, you can do a super specialty, or some people call it a fellowship there too. And then that's the same process in the United States. So in the United States, generally it takes a little bit longer, maybe 14 years. And it really depends on which specialization you do. Some are a little bit shorter, some are a little bit longer. But generally in India, you can become a doctor a little bit quicker because you don't have to do the 4-year undergraduate.
Right. So it's 4 years college, 4 years med school, 4 years residency, and 2 years fellowship, just to be specific, right?
Yeah, the residency and fellowship the number of years will vary
Right.
depending on which specialization, but generally 4 years college, 4 years med school, that's pretty much the same for almost all trainees. The general process after you finish, once you finish the undergraduate 4 years, then you have to take the MCAT, which might be helpful to talk about some of the costs that are you have to do with all these processes. But the MCAT's about $320, and then you have to apply to med schools, which it's about $42 per school you apply to, and most people will apply to 15, 20, 25 schools, so it can definitely add up. And then medical school in the United States, and we'll talk about this later, but it's very expensive. So each year, maybe anywhere between $40,000 to $80,000, and most U.S. students will take loans to pay for this. And then after that, you will match into your residency. We'll talk about exactly what that means. But at that point, you will start to get paid and the pay is pretty decent, about $50,000 to $70,000 per year. And residency can last between 3 to 7 years, depending on which specialty you go into. And then after that, fellowship, and you're paid for that too, and it can last between 1 to 3 years.
Okay.
So, so if we're looking at back to the pre-med, so your undergraduate, this is from mededits.com. It's a kind of a sample plan that a pre-med student in the United States, the kind of classes they would take during their 4 years. So to enter medical school in the US, you need to take certain prerequisite courses and get certain grades in those courses in order to qualify for med school. And so those standard courses you take throughout your 4 years, but they're like your chemistry, biology, organic chemistry, biochemistry, and then sometimes they will require physics. I don't see it on this one, but most there's physics here, but
Yeah.
most people will take physics as well. I think that's required. And then during your 4 years, you can't only just be focused on completing the coursework and studying for the MCAT, but the medical schools really want to see that you get some involvement in research projects, that you, it says clinical exposure. That means just getting into the hospital, shadowing, doing volunteer work, either in the hospital or sometimes just in your community. If you go and help homeless people or something, that is something that they would look and look favorably upon, because they want the type of person that shows that they're selfless, that they are giving back to their community, that they really care about how people that are less fortunate than them are doing. So those are the kind of activities that they'll be looking for to see that you are doing during your pre-med.
Right.
Usually around year 3 is when you start studying for the MCAT and taking the MCAT. And then in your year 4, you will start interviewing at medical schools. And then at the end of it, you'll start your medical school. Some people will take a year after college, before medical school, an initial year to prepare for the application.
Right.
They might do extra research or extra community service year or something like that, and that might make them more competitive candidate for medical school. So sometimes if you can't fit all of the kind of extracurricular activities into the 4 years, you can take an extra year and focus mainly on research or community service, so that you can build your application so that you have a higher chance of acceptance into medical school.
Right. Another thing I wanted to add, as I said before, I am taking AP Psychology this year. So if you see in the year 2 after Organic Chemistry 1, the psychology. So I'll have a certain amount of college credits because I've taken AP Psychology. So maybe I'll just have to take 1 or 2 courses in psychology in year 2, rather than say 3 or 4 that a normal person who didn't take AP Psychology would have to. And same with IB level. So in IB, I'm planning to take HL Chem and HL Bio. So here we can see Chem and Bio in the year 1 after fall. So I might have a less workload compared to someone who in school didn't take any sciences at all. So that just goes to show, the benefits of AP and taking kind of medical related subjects in school.
Yeah. So like you were saying, if you took AP or IB classes during high school and you scored high enough on the test, then you might be able to get credit before you even start college for chemistry 1 and biology 1. So you might be able to take chemistry 2, biology 2 in your first semester, and then you're already ahead.
Exactly. Okay. So the next slide, Dr. Neal has to show us.
Yeah. So now we've finished our undergraduate. We applied to med school and we gotten into our dream medical school. So what does it look like from this point on? So it's your 4 years of undergrad. You take the MCAT towards the end of that. And then once you start medical school, you have the first 2 years are mainly classroom, lecture based. There's some labs that you do where you dissect cadavers to learn anatomy. That's the first 2 years. After that, you have to take your first what's called board exam, and it's a test to make sure that you have understood the really important topics in your medical education that you should have learned in the first 2 years. So that's called the USMLE Step 1. And generally, this is one of the hardest tests that any medical student will have to take. And that's at the end of your first 2 years. And then you'll start your clinical rotations, which we'll go in deeper into what those are. But at the end of that year, this is when you're really working into the hospital and helping in the hospital and learning from patients. At the end of that year, you'll take another USMLE Step 2, which is more focused on clinical medicine and really making sure that you understand the clinical care of patients, bedside care of patients.
Mm-hmm.
And then in your fourth year is really where you focus in on your learning which specialty that you want to apply for in residency. So you take a lot of electives. You might do some more research, things like that. It's a more relaxed year. And then at the end of your fourth year, you'll match into a residency. And the residency is about, like we said, 3 to 7 years. And during the middle of that, you have to take another of the steps, the Step 3, and you'll need to pass that as well. And then there's optional fellowship after that.
Okay. And another thing I wanted to clear up for the people who are watching is USMLE actually stands for United States Medical License Exam. So these Step 1, 2, and 3 exams are all two exams for your medical license. So once you have a medical license, then you can actually kind of call yourself a proper doctor.
Exactly. So if you wanted to know more about what classes you would take during medical school during each year, so in your first year, it's really focused on what is the normal human body do. So you learn about the normal function of each of the important systems: the cardiovascular system, pulmonary, which is the lungs, renal, which is the kidneys, etc. And then towards the end of your first year, you start to learn about what happens when things go wrong. So you learn about immunity and microbiology, bacteria and viruses. And then your second year is really focused on diseases and how to treat diseases for each of the systems. And this will vary from medical school to medical school, but this is generally the same format that's followed at most places. This one I think is from Rutgers University, which is in New Jersey. Once you finish your second year, then you move on to your third year, which, like I said, you now work in the hospital.
Right.
And so you're in the thick of things. When you're on your surgery rotation, you're in the operating room with the surgeon, helping to operate with the surgeon. Then when you go and do your internal medicine, you're rounding on patients in the hospital and learning about how to treat common diseases like pneumonia or heart failure. During some of your other rotations, you get exposure to those types of patients: neurology, OBGYN, which is focused on birth and women's health, psychiatry, pediatrics, which is focused on children, and family medicine, which is kind of everything that's involved in taking care of more healthy people, in the clinic.
Right.
And that's your third year. It's a kind of broad exposure to all the types of medicine that are out there. So you don't have to know what your specialty is going to be at this point. This is really where you figure it out. You say, you keep an open mind, and whatever you really like the most, you have 4 to 8 weeks in each discipline. And at the end of it, You shouldn't have an idea of, oh, I really like kids, I want to be a pediatrician, or I really like, talking to patients about mental health and treating
Mhm,
that, I want to be a psychiatrist. Um,
mhm,
and so at the end of that, you take your step two and things like that, and then you start your fourth year, and your fourth year you do this thing called the acting internship, which is basically, it's not a true internship, but it's kind of gives you the feel of being an intern, but you're still in medical school.
mhm,
So you pick your field of interest. So for me, it was I really liked internal medicine, so I did a acting internship in internal medicine, and so I got more exposure to internal medicine. And then you'll do some other rotations, like the intensive care unit, which has really sick patients. And then you can do electives, which are really uh, whatever kind of courses that you want, like ophthalmology. You can, the study of eye, you can get more exposure to that.
mhm,
Um, there's lots of electives in medical school, so this is your opportunity to kind of get exposure to things that you may never get exposure to and really learn more about it. And important to remember is that there's always vacation time that's built in, so that you're never just working for a whole 12 months straight. You have some time um, to go on vacation and relax, and really decompress before the next rotation starts. So that's
mhm.
kind of the overview of medical school.
Right. I can make a comparison to my last video. So the third year of med school, med surgery, internal medicine, neurology, then your OBG, GYN, all this. This is kind of like our internship years in the Indian process, where we have like kind of 6 months, I think, where you just rotate through all the medical fields to kind of get a feel for each one. And then here in the fourth year of med school, where it says like these elective 22 weeks, this is kind of where you know where you kind of know, you have an idea of which specialty you want to study, and you just do electives in that. Am I right?
Yeah, it can vary. Some people want to do electives in what they want to study, but some people, they want to do electives and things that maybe they'll never see again,
Mhm,
because in medical school, it's your best chance to get exposure to many different fields of medicine.
mhm,
uh, Once you start your residency, you're really focused on that type of medicine. So if I wanted to learn more about, let's say, orthopedic surgery, an internal medicine residency, I'm never going to have the opportunity to learn about orthopedic surgery. But in medical school, I could take an elective in that, so that, in my future, if I see a patient that needs orthopedic surgery, I know what happens, what's involved in that process. So I can tell the patient, oh, for this surgery, this is what they're going to do. And this is how long it'll take, because you'll get asked questions about that by your patients. So, just because you specialize in one area of medicine, it's always helpful to understand what your colleagues in other fields of medicine are doing. And so that's why the electives are important, not only for taking courses in your own specialty, but also taking courses outside your specialty, so that you understand uh, all of medicine, at least at a basic level.
mhm. Definitely, definitely.
Involved in residency.
Okay, okay.
So you see, this is just an example. This would be internal medicine residency. This is year 1, 2, and 3. And so you'll do a variety of activities like inpatient wards, intensive care unit. You also have electives. Here you do ambulatory blocks, which is like clinics.
Mhm.
So not necessarily in the hospital, but you see patients that are coming from home. You do nighttime care of patients, and then you have time for research, and of course vacation.
Okay, okay. Okay, perfect. Well, thank you so much for that slide presentation. Having a graphic, especially for me, really helps me learn. That's why I do a lot of studies actually, watching YouTube videos. I don't know if that's just me or some other people do that too. But anyway, going on to the next question, which is kind of something more subjective to you, which is what's the honest truth about medical education in the US? Because I know like students from across the world, they all, even in top countries like the UK, they want to go to the US to study. So is the education in the US actually as good as they say? Is it overrated? Is it underrated? What are your thoughts?
Yeah, that's the $1 million question, right?
Hmm.
So I think the why I think a lot of people come to the US for education is that the best way to become a doctor in the United States is to do your medical school in the United States. It's very hard to do your medical school outside the United States and then uh, get the certification and position in the United States afterwards. So I think a lot of people are attracted to the United States for various reasons, not necessarily medicine, but the best way to live in the United States and practice medicine is to do your med school here. So I think that's one of the reasons why so many people want to come here for medical school.
Hmm.
Um, as far as if the education is better or worse than other countries, I think it's very difficult to say, as I've only done it here, so I
Hmm.
don't know how it compares to India or the UK.
Right.
But I will say generally the education is very good.
Hmm.
The hospitals here, especially the ones that are focused on teaching, are very focused on teaching new doctors and aspiring doctors on how to become doctors.
Right.
They're less about uh, money and those sorts of other things, and really focused on taking care of patients and training new doctors. So I think that's a huge advantage of medical school in the United States, is that there's a lot of focus on training new doctors. I think
Right.
you had wanted to know the downsides, and I think the downsides, one is, as we showed earlier, is that the length of the training tends to be longer than other countries,
Hmm.
because in most other countries you don't do a undergraduate college 4 years. You'll do a combined, usually 6 year,
Hmm.
medical school that incorporates some of what you would learn in college, but it's more accelerated. Um, they have those sorts of programs in the United States, but they're much fewer than the traditional 4 years undergrad, 4 years of medical school. So the
Right.
training tends to be a little bit longer than other countries. The
Okay.
other major downside is the cost of the education. As I showed in one of the slides, it's extremely expensive. It can be up to $80,000 per year of medical school. And
Oh,
the
wow.
sad thing is that's very unaffordable for most people. And in
Yeah.
fact, most people in the United States, they take loans from the government or other sources to pay for that education. And it really has an impact on people that are of less means, because they maybe feel that they won't be able to take those loans, or don't have access to those loans, or are worried about paying back that money. Or if you're from another country, you might not have access to the same uh, loan opportunities as someone that is a US citizen. So I think that's kind of one of the unfortunate things about the United States system, is that it's so expensive compared to somewhere like India, where it's, if you go to a government medical school, it's almost free, as I understand it.
Yeah, yeah, definitely. And I think everyone strives to go to the best colleges in the US, and the more renowned and the higher the name, the more expensive it becomes. Like the top the Ivy Leagues and etc. Even the UCs, they get really expensive.
Yeah, definitely.
Right. So the next question is for any UCLA specific aspirants, or any UC kind of college in general. What is your advice for UCLA aspirants?
Yeah, I think my general advice is never to get your sights set on one specific place that you want to go. I think it's such a hard and difficult process, and each school has such a low acceptance rate that while it's great to dream of your dream school, you have to be realistic that every school has a very low acceptance rate, less than 10%. But the thing is, you only need one of them to love you. You don't need everybody to love you. So
Yeah,
as long as you get one place to say, I want you to learn to be a doctor here, that's all you need. But if you do have your sights set on one particular place, let's say like UCLA, it's always good to know as many people at that institution as you
right.
can, or even work with somebody at that institution, or volunteer there, or do some research or community work. The more connection you have to a certain place, the more believable and reasonable it is to that school will say, oh, I know, see why that person wants to come to UCLA. They've done all these things with people that work at UCLA.
Right.
And so I think that's, if you have your sights set on a specific place, your dream school, then that's the best way to make that dream a reality.
Mhm. Definitely, I think like getting in touch with the professors or trying to work with the professors, although it might seem really hard, which it is, it really makes your application to that school specifically that much better. Um, so another the question that's more subjective to you is how and when did you decide you wanted to take internal medicine and then cardiology?
Yeah. So if you think back to the process of becoming a doctor, I think it was around the middle of medical school, or towards the second year of medical school, where I was taking the uh, preclinical courses on the different diseases and the treatments of disease. And what I realized is I really liked all the different systems and how they work together. I didn't necessarily just like neurology, for instance. I liked how everything was connected. I liked how the heart was connected to the kidney, connected to the lungs. I liked how everything worked together. And internal medicine is the field where you really have to think about all those different organ systems and how they relate to each other. And you can't just focus on one particular system. And I also didn't like surgery that much. In the anatomy lab, I was the one that said, oh, you can cut and dissect, but I'll look over and at the textbook and learn about the different structures and just look over your shoulder. So I realized early on that surgery wasn't what I wanted to do. And then as I was in residency, I learned about the different fields and subspecialties in internal medicine, and I really liked cardiology the most, because the heart is such an important organ, and you can't live without a heart. So I really enjoyed uh, those rotations, and that's why I wanted to become a cardiologist.
Definitely, definitely. That's really interesting, and I feel there are lots of different specialties in medicine that do focus on just one liver or just one organ or one part of the body, and seeing that you were interested in the whole body. Really, it's different. It's interesting. So the next one is it kind of goes back to what students can do in high school to it's what can students do in high school to boost their college application to see that this kid really wants to become a doctor, or we want this kid to become a doctor in our school.
About medical school is that and undergrad competitive to get into the top programs. And so you have to do more than just get good grades. You have to definitely do well in all your classes in high school, and try and rank in the top of your class. But it's really more than just grades that they're looking for. So if you think about the characteristics of a good doctor, they are leaders in their hospital. They communicate well. They're selfless. they take a lot of time to give back to their community and are less worried about their personal gain. Those are the kind of characteristics that they're looking for in a high school student. So
Mhm.
obviously they can't go around and follow you and see how you interact in your day-to-day life. So they're looking for things on your application that speak to those qualities. So those
Mhm.
things are volunteer work that you've done, um, shadowing in the hospital, volunteering in the hospital,
Mhm.
leadership positions in your high school. So if you were the captain of your football team or the uh, captain of your speech and debate team, those
Right.
are looked very highly upon
Mhm.
as traits that will make a good doctor, and that's really what they're looking for. So my best advice is to definitely study hard and do well in your classes, but make sure that you are more than just someone that reads the books and does well on the test, but you are a complete person that's going out into your community and helping people that are in your area, and that you are taking leadership amongst your classmates and really showing what you're passionate about. And I think if you can do that, that'll be communicated in your application, and will be looked upon favorably. And they'll say, "Oh, I want this person to come to my college and medical school and become a doctor, and they'll be a great doctor."
Definitely, and I think it's really funny because in the three countries that a lot of doctors are made in, which is India, the UK, and the US, the process of applying and everything is so different. Like in India, they only care about a test score. They only care about a test score. It doesn't matter what you did in high school, how well you did in high school. No, no, it's just in the medical entrance exam here. You do well, you get in the UK, it's all about what grades you got in high school, nothing else. No extracurriculars, not the test score for entering the med school as much. Of course, that is taken in consideration, but not as much as India. But in the US, it's everything. It's like everything you did in high school, the marks, the extracurriculars, and of course the entrance exam marks as well. So I think it's definitely you have to do more to get into colleges in the US rather than just shoving your head into the books and getting good marks.
Exactly.
So our second last question is we know the US pays very favorably to doctors, like very very high. So are there some figures for specialties, and when does kind of the money start coming in? Because till for like a long time it's just you paying money to the school for the education.
Yeah, so let's go back to that presentation. So I showed you this slide, which was the general overview. And so for these first three steps, you're paying a lot of money to become a doctor.
Hmm.
Once you are in residency, then you're paid about fifty to $70,000 per year,
Hmm.
and the similar amount in fellowship. But
Right,
once you finish fellowship, that's when your pay really goes up a lot. So when you're a full doctor, and so
right.
these are the average yearly salary for the different specialties, and you can see that it varies a lot based on the specialty. But in general, even the lowest paying one still gets paid a lot of money uh, compared to the average person. And for reference, the average yearly salary in the United States is about $50,000. So even in
Oh
pediatrics,
wow.
there's still four times as much as the average person.
Yeah.
Um, so it costs a lot of money to become a doctor in the United States, but at least on the once you finish the process, then you're paid very favorably. And for a lot of doctors, their first 5 years are really 5-10 years are really focused on paying back their loans. But once they finish that, they can live quite comfortably. So you can see in the different specialties, and every year it changes a little bit, but generally this is kind of the estimation of how much you will earn per year. And so you see plastic surgery is very high, almost $500,000. But
Yeah.
even if you're in a specialty of general specialty like internal medicine, you're still making a very, very good salary.
Hmm.
So those are the different figures, and
Hmm.
depending on where you work and how much you work, you can make more or less. But it's very favorable compensation for doctors in the United
Right.
States.
And I think for all the doctors who want, all the aspiring doctors watching, I definitely think, yeah, we all know that doctors get paid a lot, but don't go into it for the money, because after a point it's a long journey of lots of studying. So if you don't enjoy it, then you're going to get burnt out and you're going to hate what you're doing. And at the end of the day, you want to enjoy what you're doing in your life, so why dislike it? And I definitely feel if you genuinely do have a passion for sciences and the human body, then only then should you go in, right?
Yeah, that's a very insightful comment. The field of medicine is, it's not about money. There are other ways you can make money faster, um, but it's really about being passionate about taking care of patients and learning the processes by which patients get sick and how we can treat them. That is what being a doctor is about. It's a very, very difficult and long process. And you have to be, like you said, very passionate about it and really focused on, what your goal is, which is to help people.
Exactly. Um, well, now we are at our last but not least question. It's really flown by, and it's really been a very insightful and enjoying full experience for me. But the whole point of Med Speaks is the selling point of it is it's very raw. It's not like those government induced articles you read when you search up how to become a doctor. It's meant to be the real honest truth. So what are the downsides of this very noble and highly looked upon profession in the US? Because everybody just looks at how high about how good it is, but we know that everything in life has its downsides. So what are the downsides of being a doctor in the US?
Yeah. So I'm glad that you asked that question because becoming a doctor isn't for everyone. You may have, you may be able to work hard, but you might find that the process, the length of the training and the hours you have to put in each day are maybe too much for you. You have to sacrifice a lot of your youth, your 20s. Some of the best years of your life are devoted to learning to practice medicine. And that's a sacrifice that you have to be willing to make for your end goal. So
Right.
if that seems too much for you, which it may be for some people, and I think that's okay, you just have to learn about yourself and know yourself. There's always something else for you. But I think if you are willing to put in the time and the effort and the hard work, and you're really passionate, it's a great career that's very interesting. You build a lot of close relationships with your fellow medical students because you spend so much time studying with them. You have a great relationship with your colleague in the hospital if you're ill. So I think those are many of the advantages. And of course, you build very special bonds with your patients who,
Right.
in their darkest of times are looking to you to help them.
Hmm.
They tell you, things that they've told anybody else, or they'll tell you their pain and their suffering, and they look to you for relief. And it's your job to, hold out that hand that can help them become better. So I think that is what practicing medicine is all about. And I think um, there are many downsides: the length of training, the cost of the training, the hard work it takes. But you have to ask yourself: is the end goal, is it worth it to me? And for some people, it'll be a resounding yes, and for some people, it'll be no. And like I said, that's okay. But
Exactly.
the important thing is to ask yourself that question.
Hmm. Definitely, and I feel it's a very big contrast between the downsides of being a doctor in India and the downsides of being a doctor in the US. Because, for example, the last doctor we had, he said he had a really bad experience about a patient and his family who threatened to, harm him and harm the hospital itself if they don't cure the patient within the next day. And I think in a country that's, I would like to say, more civilized than India, that it's good to hear that those things are very rare. And another thing is, here in India, another thing the previous doctor said was, in his years of residency, there weren't enough beds in the hospital for him to sleep in when he was doing call. So he had to actually sleep in his car outside. So it goes to show, when you're studying medicine in a third world country compared to a first world country where there's a lot of more money, um the experience can be a little more premium, or more enjoyable, even though you have to put in a lot more money. But I guess, the more you put in, the more you get out, right?
Yeah, and I think, thankfully, I've never encountered a situation like your other doctor did with the
Hmm.
patient, threatening. But that those are things that very rarely can even happen in the United States. And I've never had to, sleep in my car because there weren't enough beds. But I think you touched upon an important thing, is that it is a premium in the United States to enter into medical training. And that's, I think, a very sad part of it, is that you have to have some usually you have to have some means to be able to pursue the training, and that can be very unfair to people with less means. So that's a major downside, and I think that is something that in the United States we are really working on,
Hmm.
making sure that training for medical school is accessible to anybody from any background. And I hopefully that is not something in the future that stops someone that is very passionate about becoming a doctor, whether they're in the United States and they are of low means, or if they're from another country and they want to learn to be a doctor in the United States. I always hope that money and access to resources never stops them. So um, that's another the dirty truth about American medicine, is that there's these things that are unequal.
Hmm. Another question I wanted to ask, which is, maybe subjected to you, maybe some of your friends might have gone through it, is, do like international students face racism when they come to the US, or is there kind of some kind of disprivilege or a privilege white people have in the process of becoming a doctor?
Short answer is yes, there's discrimination.
Hmm.
But the long answer is that there are many, many, many things that are being done to make sure that uh, we are fixing that problem. And so I can, my parents, they trained in India, and then they became doctors in the United States. They faced a lot of discrimination, especially early in their career and throughout their career.
Hmm.
But I think compared to how things were 20, 30 years ago, it's better now, but it's not perfect. So um, I think we're doing the right things to become better as society, but there's still a lot of discrimination and much more difficulties for people that are not American or not white, but it's a work in progress.
Definitely. And I think it's so funny that international students even have to take this into consideration when we want to apply abroad. It's, will I be at a disadvantage just because of my skin color? And I think another strife international students face is the visa issues, because we have to apply for student visas and etc. And that's a whole different procedure which does involve, again, money. So it's definitely harder in those terms to become a doctor abroad, especially when you're coming from a different country. Whereas here in India, there's no visa that I would have to apply for. There's no discrimination I would have to worry about because I'm the same color as everyone else. But I guess these are the things we have to keep in consideration when we want to have a better, more premium education somewhere else.
Definitely.
Well, that concludes our MedSpeaks episode for today. Thank you so much, Dr. Neal, for coming on with us. This was a really insightful video for me because I'm actually trying to study abroad in the US specifically. But yeah, I'm sure everyone else watching, every other young aspiring doctor really appreciates you coming on today.
Yeah, thank you so much for having me on, Kabir. And I'm really looking forward to watching your journey of becoming a doctor. And I think this podcast is an amazing service that you're doing to so many aspirational students that will really get a lot from it. So thank you so much.
Thank you so much. And I'll see you guys in the next video.